Hi, welcome back to Straight Talk. We're talking about peer programs, helping young people. What are we giving back to the community? And as an agency, the Chase Brexton, the health center now, health clinic? Health center. That's been around Baltimore for a long time doing wonderful work. And now they have a program called the Power Project. And joining me is Jasmine Pope and James Burrell, both involved in this project. Jasmine, tell us about Power Project.
So Power Project is, power stands for protecting ourselves with every resource. And it is our project, it is our intent to be able to have an effect on how HIV is affecting our communities by having outreach workers and peer navigators provide outreach to those who are most at risk for becoming HIV positive, for people who are positive and not into care, linking them back into care, and just providing general information about how to protect yourself from HIV, whether it be condoms and also pre-exposure prophylaxis known as PrEP.
Right, right. Now, is this kind of a street-based program where you're out into the neighborhoods, into the streets?
So we're out in the community as well as doing services inside of Chase Brexton. What we found is that you can't have healthcare in one central spot when you're trying to accomplish a task that affects a whole city. And so finding those areas, those populations where the prevalence of HIV is higher, and then making sure that we're getting our mobile van out and our outreach team out to talk to people about having treatment or getting tested. Another prevention method is treatment as prevention, because people who are in treatment and their viral loads are suppressed have less than a 4% chance of passing the virus on to someone else. So we not only want to find people who are newly positive, but we want to find people who may be positive and don't know it and get them into care so that they can be their healthiest selves and to eliminate or to bring down the rate of HIV in those high-risk areas.
Now, it's a hard question to answer, but just in a general, are we doing better when it comes to HIV? Are we still have a long way to go? How would you assess it? You're out there working.
I mean, anecdotally speaking, people are talking about it more.
Yeah.
We're trying to create programs where talking about HIV and STIs becomes a regular thing that we do in our relationships with people. We offer couples testing so that you can come into the room and make an agreement about what happens if someone steps out, or each other's status at the same time, and having that be a joint conversation. I think that's one of the most important things. And then I think our peer navigation piece has also had a great effect on how many people we're able to reach and who we're able to reach.
Right. And James, you're the navigator.
Correct.
You're the top navigator.
Yeah.
Tell us about the navigator piece of this.
Well, the PrEP navigator, peer navigator that we do at Chase Brexton is that we meet people at their level. So it's you come in, or whether we're out in the community or you come into the office, we meet you where you are. And so what our job is to do is, like Jasmine said, get you into care if you have been out of care or not in care if you're HIV positive, and also to teach you about the steps of sexual health, HIV prevention, which the PrEP comes into play as part of that. And with my job in dealing with the PrEP is making sure that people understand exactly what PrEP is, how PrEP is used, and how it will be beneficial to you and your partners, whomever they may be. So we make sure that we educate everybody on all the things that they need, all the tools, all the steps, all the processes, and even helping them obtaining the medication and making sure that they stay healthy and all the correct information that they need.
Now, I'm sure people are watching going, what is PrEP?
So PrEP is the pre-exposure prophylaxis.
Okay.
And what PrEP is a medication called Truvada, which is used for people who are HIV negative, that they can take this one pill a day, every day, to prevent them from contracting the HIV virus if they are having unprotected or risky behavioral sex. So we like to call it at Chase Brexton like the birth control to HIV.
Yeah, the efficacy of PrEP is shown to be about 99% in people who are taking it every day the way that they're supposed to take it. And so what we've been charged to do as the Power Project is to let the community know that this is a treatment that is available, so that people who are in what we call serodiscordant relationships, which means you may have an HIV positive partner and you're negative, It's another way you could protect yourself. If you don't know what your partner's status is, it's another way that you can protect yourself, but to get the education out. And a lot of times people...
And this is just a pill.
This is just
one
a pill. One pill, once
Gotcha.
a day, but in order for it to be as effective as possible, you have to take it every day. So sometimes that can be a barrier, but when you weigh it against the odds of what could happen if you're not being as safe as possible, then we're hoping people make the right decisions. And so that's kind of what we're here for, to help people make the most healthy decisions and give them the knowledge to keep themselves safe.
And the resources, it sounds like, with...
And the resources. So
you know,
not
there's
only
a lot of
just
things,
giving them the information, but making sure that they have a way to pay for it. So the peer navigators will go through insurance and make sure that there's different programs that we can get people linked to pay for PrEP and just regular STI testing. And then that comes with a whole kind of slew of other things of when people are having risky sex. Maybe an issue is housing, or you know you're getting into like psychosocial needs. And so we have outreach workers and peer navigators there to kind of help guide through those other difficult parts that may keep people away from medical care.
Yeah. Have you seen with this new heroin epidemic, kind of, here we are again, kind of full circle with more and more people who are injecting drugs. Are you seeing an increase in HIV from that population? Out on the streets? What do you hear on the streets from that?
So I don't have data in front of me. Anecdotally speaking, I can say that we are seeing more people becoming HIV positive in areas where it may not have been as prevalent before. Younger kids, you know, a lot of times in Baltimore, we may sort of kind of stigmatize African American men who sleep with men and say that that's where HIV is concentrated, but it's really spread out amongst a lot of people. And I think with this heroin epidemic, people are starting to realize that, you know, bringing back those old things of cleaning your works and how to safely use, you know, what we thought needle exchange, and not so important anymore. That generation knows about it. Well, now there's a whole nother generation that's going to need to be taught those same things so that the virus doesn't become prevalent in those areas
That's
where it doesn't really have to.
We're gonna see everything come back around. But listen, congratulations.
Thank
this
you.
is such an important service. I mean, it's so important, you know, and again, I think a lot of people out there might not think it affects them, but this affects all of us.
Yeah,
we all have to deal with it.
We'll be at the Be More Healthy Expo this Saturday doing testing. And so if you don't know your status, come out and get a free giveaway and know what your status is.
Sounds great. Well, thank you so much. And good luck. Keep up the great work.
Thank you.
Thank you.
Great. When we come back to Straight Talk, we're going to talk about amazing numbers of resources and programs through Rec and Parks this summer for our kids. So you really want to stay tuned if you've got kids that are going to be around this summer. So stay with us. We're coming right back to Straight Talk.